If you have come off a psychiatric medication and developed protracted withdrawal symptoms, you may be considering reinstating your previous medication. If so, this video is for you. It will guide you through the murky topic of reinstatement. So first up, what is reinstatement? Simply put, reinstatement means getting back on the medication that you stopped. And while this might sound simple, there are many questions about reinstatement and how it should be done. These are questions like, why would you reinstate? At what dose should you reinstate? What are the risks of reinstatement? How does time off the drug affect the success of reinstatement? How long should it take to feel better after I reinstate? And when should I abort reinstatement? So if you're concerned about any of these questions, don't worry. We will cover all of that in this video. And if you watch to the end, I will give you my personal take on reinstatement, including who I think it is more likely to help. So to start with, why would you reinstate? The whole rationale of reinstatement is to improve symptoms by reversing withdrawal symptoms. This can be simple and result in a full improvement in some cases, and it can be more complicated and result in only a partial improvement of symptoms in others. So let's first address the simple scenario. You have just in the last couple of weeks abruptly stopped a medication or made a significant reduction, and you're in an acute state of withdrawal. In this instance, the majority of your symptoms are likely due to acute withdrawal, so if you were to reinstate, the majority or all of your symptoms should improve. And this should be easy enough to understand. But the next scenario, which is the more complicated one, and the one that I deal with in my practice, involves individuals who have stopped the medications maybe 3 to 12 months ago, and they are still feeling absolutely terrible. They're outside of what would be thought of as the typical acute withdrawal window, and they are now experiencing protracted withdrawal symptoms. So for these individuals, they're usually experiencing bad symptoms from two different underlying biological processes. So let's talk about them. So the first is lingering drug withdrawal symptoms. This means the symptoms the person is experiencing due to the disordered brain functioning caused by the absence of a drug that the brain had previously shaped itself around during the years of use of that drug. Because this removal has now thrown the brain into a state of imbalance, the brain has simply not had enough time to fully readapt to its absence, and this leads to withdrawal symptoms. In most cases, the vast majority of acute withdrawal symptoms should fully resolve by about 3 months off the drug. That's why these cases are more complicated at the 3-month mark. It's because any enduring symptoms become less and less likely to be true withdrawal symptoms at this time. After about 3 months, it's much more likely that the symptoms are more starting to be due to the second underlying process, and that is symptoms from damaged neurons. So the other biological process at play is simply one of underlying neuronal damage. As we've discussed numerous times on this channel, in a small subset of people, withdrawal symptoms appear to trigger neuronal damage. It is thought that the longer that you've been in a state of significant withdrawal, the higher the risk is that you will begin to develop this kind of neuronal damage. To me, this is the fundamental reason why many protracted withdrawal states have gone on for years and that they do not improve with reinstatement of the drug. This is because these are not issues where the brain is simply missing a chemical that it has adapted to in the past. It is more that the withdrawal syndrome has now caused a neurotoxicity that has damaged the neurons, and they simply need time to recover. So the second scenario, dealing with patients more than 3 months out from their cold turkey or their drop, is more complicated because the likelihood of a full improvement in symptoms has now greatly reduced. It is possible that reinstatement may only allow for a partial improvement in symptoms because it's only going to treat any residual lingering symptoms from the initial acute withdrawal, which is likely mostly past, but it's not going to improve the symptoms from the underlying neuronal injury that has likely co-occurred. So what dose should you reinstate at? You want to find the lowest dose that results in improved symptoms. Knowing where to start depends how long you have been off the drug. In general, the longer you've been off the drug, the lower the dose you should start with. This is because the brain has already readapted to its absence to some extent. Although there is a degree of experimentation in this process, I'm going to provide some general estimates that I use when reinstating my patients. So if you've only been off the drug for about 2 days, I would go back to 100% of the previous dose. If it was 2 weeks, I'd try 50% of the last dose. If it was a month off, maybe 25% of the last dose. And if it was greater than 3 months off the drug, I would try 5 to 10% of the last dose. Clearly, there's going to be a degree of experimentation with this, but the principle is that by about 3 months off the drug, most of the readaptation to the absence of the drug has likely already taken place. So what are some of the risks of reinstatement? One key reason to reintroduce smaller amounts of the drug after someone has been off it for a long time is the risk of what is known in the withdrawal community as kindling. Many people have noticed that after being in a state of protracted withdrawal and then reintroducing their original drug, that they find that they have adverse reactions to the medication which they did not have before. This is likely due to the neuronal damage sustained from the original withdrawal. Because of the risk of having an adverse kindling reaction upon reinstatement, it is important to not overshoot the reinstatement dose and to generally keep in line with the recommendations in this video. And remember, if you have a strong negative reaction initially, you may have started on too high of a dose and you should stop immediately and abort the reinstatement. So how does time off the drug affect the success of reinstatement? Generally speaking, the longer you are off the drug, the less likely your symptoms are due to the absence of the drug. Most withdrawal syndromes without neuronal damage are fully recovered by 3 months. That said, some people have reported success with reinstatement even 12 months or longer off the medication. However, these reports are uncommon, and usually the chance of reinstatement improving symptoms is very low after 12 months off the medication. How will I know if reinstatement is working? Sometimes it can be very obvious that reinstatement is working. Many people, especially those who have been off the medication for less than 3 months, will report some improvement in symptoms even within a day. And so what I'm looking for when I reinstate my patients is 2 things. I'm carefully watching to make sure they don't get worse. And if they get worse, I stop the medication and I may consider reintroducing it at a lower dose. Second, I'm going to be looking for any marginal improvements. If I begin to notice a marginal improvement, I'm satisfied that I found enough of a dose to help. Usually at that time, I will hold on the dose for 2 to 4 weeks. I like to wait 2 to 4 weeks after I reinstate and find a dose that's kind of improving things, because sometimes it can take up to a full month to fully notice the improvements from reinstatement. And as a general rule, I won't increase the dose further if the patient continues to report a gradual improvement in symptoms. If after starting reinstatement there is no change at all within a week, I'll start to gradually increase the dose each week towards their last dose on the medication to see if there's going to be any improvement. If I don't notice any improvement, or if I begin to notice a worsening, I'll start to remove the drug quickly, usually stopping it in roughly the same amount of time that they've been on it during the reinstatement. So how long should it take to feel better after reinstating? This area is perhaps the most gray, since some symptoms will recover quickly and others may not. Only time will tell how many of these symptoms will respond to this. However, typically most of the beneficial effects of reinstatement are present by about a month in. It's also very common with reinstatement, especially after several months of being in protracted withdrawal, that the symptom improvement is only partial, since it's never going to improve the symptoms that are due to neuronal damage. When should I abort reinstatement? Reinstatement should be aborted if you notice a sudden worsening in symptoms. If you do, you're likely experiencing a kindling reaction. Reinstatement should also be aborted if you've gradually increased the dose to the previous amount and you've not noticed any noticeable improvements after about a month. At that point, there's no real benefit to being on the drug, and it should gradually be removed at roughly the same rate of initiation. Okay, so now that we've discussed reinstatement, who do I think should try reinstatement? Generally, I would recommend it for anyone who has been in a protracted withdrawal state for less than 1 year, especially if they've not noticed any improvement. Now, if someone is already recovering, even slowly, I would be more hesitant to reinstate them, since the injury is clearly not worsening and their brain appears to be recovering slowly on its own. In these circumstances, I would rather avoid the complications and the risks of reinstatement and simply let the symptoms improve on their own. This is because I've heard countless stories of people going back on their medications only to experience adverse reactions and then have a more challenging withdrawal experience when they try to stop them again. That said, now who do I think should be more hesitant to try reinstatement? Generally speaking, the chances of reinstatement working for those who have been in protracted withdrawal injuries lasting longer than 12 months is much lower. That said, I wouldn't blame you for trying if you were desperate and you simply want to turn that rock over to see if there's any marginal improvement. If you decide to do this, just make sure you start at less than 10% of your last dose and proceed very cautiously. So I hope this introduction to reinstatement was helpful and it gives you clarity and guidance on what can be an intimidating topic. If you're looking for help managing issues like reinstatement or drug tapering, we work in several US states which are listed on our website in the description below this video. Thanks so much.